A century ago, in the logging camps and timber mills of the Pacific Northwest, an innovative idea took root, and the compassionate spirit of Cambia Health Solutions emerged.
When I think back over the 100 years that our company has been in existence, it's remarkable how the actual company began. These were timber workers working in a pretty dangerous industry where the idea of suffering an injury in the timber mills or up in the logging camps was common. It was about people who were deeply in touch with the needs of the people they saw around them, the people they worked with, the people they cared about in their community. And they came up with a way of addressing that need, and they didn't even know what to call it.
As the years passed, we were there. For every breath, for every step, for every second. Growing as our communities grew.
My name is Patrick Elliott Young. I just reached 100 on March 6th. I had been a prisoner of war for 3 years and 8 months. I came to the States in '53, where I had a job waiting for me. At the present time, I do like walking. I've done the Shamrock 3 times. I've done the Great Columbia Crossing, which is 6 miles, twice. Blue Cross, they've been the only people we have been with. We find them very, very good. It's a cinch.
Through it all, change has remained the one constant. Change that we advocated for, even insisted on, with our eyes toward the future.
Innovation is huge. We live in an era today where you can actually pay for your morning coffee with your watch. And so with that in mind, our clients expect us to be able to keep up with that type of modern technology. Healthcare is not excluded. It needs to be seamless, it needs to be quick, and it needs to be uneventful.
As we celebrate the rare milestone of 100 years of service, we continue to transform healthcare and lead the industry we founded.
Wildflower Health's mission is to make families healthier. And the way that we do that is by deploying really consumer-focused smartphone applications that help families better connect to the healthcare system in a really personalized way in moments that matter, like when you're having a baby or when you have a sick child or another sick family member. You know, people at Cambia were asking me, Leah, how are you going to help providers and consumers and patients? But I found that Cambia thinks so much more broadly about the healthcare system.
We have a community crisis that deserves a community response. And our crisis now is homelessness. With the gift of Cambia, we were able to start a housing and wellness advocate program. It was a phenomenal gift. It allowed us to partner every family and every woman with an advocate because we want you to call our shelter home for now.
We are on a continuous journey, creating and investing in innovations designed to meet the changing needs of those we serve.
Healthcare focuses way too much on what's the matter with you as opposed to starting with what matters to you. We don't get to the next 100 years if we keep looking back to what others have done and then just say, well, that's good enough. We get to the next 100 years if we look out and we see what's going on in the world around us and we see it as an opportunity for innovation.
Our founders could never have envisioned a future that looked like Cambia, but they would recognize us. We may be far removed from our origins, but not from our roots. We will forever innovate. We will continue to grow and partner to better serve people and their families on their healthcare journey. We will always look toward tomorrow, toward next year, toward 100 years from now.